The state of Texas is developing an application for a new rural health funding program, and that plan includes $50 billion to transform rural health.
GMAT's Emma Kay is here to explain how hospitals will get this funding and the challenges for rural communities. Good morning.
Good morning. In the last decade, the state of Texas has lost 14 rural hospitals. Just this April, we saw the closure of the hospital in Trinity County. At the time, its CEO shed some light on financial troubles that weren't unique to the Mid-Coast health system.
These run out and it's just not sustainable at this point.
Right.
The majority of rural hospitals in the state, in the nation, are operating at a loss.
This year, money troubles have also come to a head in Nacogdoches, where the county hospital district approved a $5 million loan. The hospital district said the funding was needed to help cover the costs of patient care and paying vendors. A new report shows about 70% of the state's hospitals have lost services, and more than half are still at risk of closing. That's according to the Center for Healthcare Quality and Payment Reform. More federal funding would be significant for rural communities where hospitals face challenges, including lack to access of transportation and internet. Texas' new Rural Health Transformation Program is meant to focus on transformation and innovation, and hospitals will get this funding based on applications they submit in November. During a public hearing on Monday, several hospital leaders said that without direct funding, more rural hospitals may be forced to close. Lane, Deanna, back to you.
All right, Emma, thank you.